Our Community Health Improvement Plan, also known as our CHIP, really creates a shared vision for health improvement in Wyandotte County over a course of 5 years. It's intended to be a collaborative effort where we bring together different sectors across our community to address the most important health priorities to our community members. And for the last 4 years, those priorities have been jobs and education, healthcare access, violence prevention, also safe and affordable housing.
I believe that the CHIP Safe and Affordable Housing Action Team has been able to bring those things together and to collaborate. So when we're all in our different circles, we're talking about the same things with the same context and the same ideologies.
Not one organization here in Wyandotte County can move the CHIP plan forward. It takes all of us, and we all have different expertise that we can bring to the table.
I think the collective efforts of the CHIP is important because without these discussions through the various elements and the various agencies that are involved, you wouldn't have this sense of community around the issues. It would just be the public health department's role, their job, and it's not. We're also working on bus tours to get our students engaged in the companies that we already have and these really interesting automation, artificial intelligence. I mean, you name it, there's some exciting stuff going on. You don't have to leave Wyandotte County to have a great quality of life and a great future for our families.
The work of the CHIP has improved the ability for folks to see the intersectionality of all of these related important topics or things that each of us say matter. Over the last 5 years, the CHIP Safe and Affordable Housing Action Team has accomplished a lot. Whether that be our education series around the landlord-tenant toolkit, responsibilities toolkit, how the eviction crisis has evolved post-pandemic and what that means for families here in Wyandotte County.
MOXA, the Metropolitan Organization to Counter Sexual Assault, has been involved with Wyandotte County since 2014. We've been involved to try to prevent sexual assault and get to the root cause.
MOXA often focuses on sexual violence. Our work with the CHIP focuses on community violence because we know that all violence is interconnected. We actually did a youth-led prevention programming this summer with Young Women on the Move, which is a wonderful local organization that works with young girls in the schools and during summer programming. And so what we did is we provided like kind of baseline education on sexual violence, like healthy relationships, consent, respect, what those things look like. The youth fully marketed it on their own. They created the materials for the marketing and the outreach. They determined how they were going to get attendance to these different events.
We have been able to focus in a couple of different areas. One has been on increasing awareness of the importance of Medicaid expansion. And then shortly after that came the news of the Medicaid unwinding. So a subcommittee was formed in order to address efforts on making sure that all of our Wyandotte County community members were aware of the Medicaid unwinding process. Additionally, we have been a part of the WYCO Care Link subcommittee that is focusing on transportation efforts within Wyandotte County.
We have taken a framework that has been integrated into the Community Health Improvement Plan that has allowed for us to be designated by the Center for Disease Control and Prevention as a Youth Violence Prevention Center of Kansas City. We come together with many community partners, over 40 partners that participate with the Thrive Systems Advisory Board and as partners of the Community Health Improvement Plan to think about what it is that we can do collectively as a community to address particularly youth violence.
We had all these partners like Crosslines and Vibrant Health to provide food boxes to families' homes while they were experiencing quarantine, and also to administer COVID shots or COVID vaccinations.
The work of the CHIP has improved the ability for folks to see the intersectionality of all of these related important topics or things that each of us say matter here in Wyandotte County.
All of these things pulling tandemly together, that drives real community. It's not just checking off boxes. It's not just another number, but these are people that we're trying to help have a better life. And if we can do that through these really progressive conversations and relationships like we have with the Public Health Department, then great. We think it's the best practice.
The work of the CHIP is important because the residents want sustainable change in their community for the better. And we're here to lead that, or I don't even want to say lead. We're going to guide everyone in this community on that journey. If you want to join, you want to be a part, you want to see sustainable, long-lasting change in your community, that's what we're here for. That's why it's important. That's why we want you at these meetings. That's why they're open. And that's why we're here.
The most rewarding is really connecting with residents. There is a lot of passion and a lot of care for this community.
My experience working with partners and collaborators throughout this process has really showed me how important Wyandotte County is to so many people. That is a rewarding part of this work, is being able to collaborate and bring together like minds with the same purpose.